Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. Stella Kang, Professor of Radiology at Columbia University, who is editor of our Evidence Synthesis and Decision Analysis section. In this video, she'll be sharing with us her insights about the area. Stella, thanks for joining us.
Thanks for having me. I'm really pleased to be able to talk directly to you as well as our readership and any potential authors who may be submitting to evidence synthesis and decision sciences.
To start us off, can you tell us about your background in evidence synthesis?
So I am a decision analytic modeler, which means that I use mathematical modeling to assess the best clinical decision possible. And as radiologists, we are always contributing through our test interpretations to making the best possible clinical decision. And so naturally, it was important not just to develop the decision analysis skills, that's half of our section, but also in general evidence synthesis. And the idea, the old adage, of course, is garbage in, garbage out with computer models in general. And so it's exceedingly important to understand how to appraise the evidence and the quality of the evidence and to get a lay of the land in the way of what the current evidence shows. So through my interests, I pursued some formal training in these areas in systematic review and meta-analysis, as well as decision analytic modeling, both through a master's program as well as direct research experience. And I continue to use it to this day.
So let's move on now to the journal section. What trends have you observed for recent AJR submissions in this space?
In terms of trends for the submissions to evidence synthesis and decision analysis, we've had some terrific papers recently. One trend I would say is that we've had some excellent submissions regarding the state of the evidence on exciting molecular imaging techniques, now that those are really gaining steam and growing a whole body of literature for several agents now. And then we also have a trend where there are some great techniques in interventional radiology with an accumulating body of evidence, including trials and or look at patient-reported outcomes. And recently, we just had an excellent AJR Live, for instance, looking at the cost-effectiveness analysis for minimally invasive therapies for knee osteoarthritis as a bridging therapy to a replacement. So those are some exciting trends. I would say we also see excellent submissions still for newer techniques, whether it's for MRI, right, and some updated sequences for cancer detection especially, and a number of other clinical questions that are always going to be important and will therefore have an accumulating body of evidence to update.
You make a good point about how the section covers a wide scope and provides a home to submissions on so many different topics. What do you see as areas of priority for publishing and evidence synthesis over the coming year?
I would say if we continue to see submissions in those areas I just described, that would be terrific. We're always interested in innovative new sequences that are gathering steam, that have a growing body of literature accumulating. We're also interested not just in, for example, disease detection, but disease characterization, right? Or even sometimes there are important papers that are the first to summarize things like, again, patient-reported outcomes or the cost-effectiveness literature or other aspects that can be covered through systematic review too. So sometimes there's an interesting variety, and any of those areas that are important to guide imaging use and to sort of point a direction and provide a compass to the most promising imaging techniques, those are always going to be of interest.
So what tips do you have for authors looking to publish in the area?
Often, one of the most challenging aspects of systematic review is simply nailing down the study question. And so using the PICO format, or sometimes in radiology we call it the PIT format, because we often just have an index testing condition that we're interested in. And we're really interested in having pretty specific systematic review questions that are being answered. More rarely, there are some scoping reviews if it's at a very early state of the technology but it seems to be one that is gaining a lot of interest because it perhaps was an area of disease characterization that wasn't possible before, right? Scoping reviews, those are possibly of interest. But classically, we like to have the systematic reviews that are directly delving into a focused question. And then I would say for decision analysis, part of the most challenging aspect of getting a study off the ground, whether it's a classic decision analysis model or a cost effectiveness model, is choosing the most relevant strategies. And so sometimes it can be challenging to pick the most fair comparator. For example, if it's a modality comparison, you want to give fair comparison to all those modalities that are commonly used for a particular question and not leave out one that could very much alter the results, if that makes sense. So those are just some basic tips for getting a study off the ground. And I would say for any of these kinds of submissions, because of the truly multidisciplinary nature, for example, of decision analysis where you're projecting outcomes, having the input of key clinicians, key clinical collaborators can make a big difference in having a paper that is perhaps seen as being a little bit narrow in scope or myopic in how the author team views the problem versus having a very rigorous analysis that incorporates clinical experts' opinions too.
Yeah, that early point you made on the specificity and clarity of the study question is so important to highlight. So are there any other particular common pitfalls that you're seeing in submissions?
Of course, we all struggle with producing, the best possible paper sometimes, despite limitations that we find in the primary literature. And that's true for almost any systematic review. And in the diagnostic test accuracy world, we're often limited by case control designs. Right? Rarely we'll have some cohort studies, and we will often allow for a mix and match type of approach because of the way the diagnostic accuracy literature and the way our tests are most often conducted. So that's acceptable. I would say what is problematic sometimes is if authors skip certain expected aspects of systematic review. For example, not conducting a quality assessment or leaving out some important insights with regard to specific limitations they're observing in the design of the studies, the primary studies in their systematic review. Those can be really helpful insights for readers and also the authors if they're thinking about designing their own future work in that area. And then another pitfall in general, whether it's decision analysis or systematic review, is overstating conclusions. And so that's always something I think in the scientific literature that needs to be paid attention to. And it's true in this section too.
That is also really key to highlight, that systematic reviews cannot solve issues inherent in the article that themselves are being analyzed in the review, which authors need to keep in mind when considering why they are doing the systematic review in the first place. So last question, is there anything else that you'd like for our listeners to know?
We are really excited to have this as a unique section in AJR. As many readers may know, most often these types of submissions are within an individual section, whether it's gastrointestinal imaging or musculoskeletal. But this is really a unique feature of AJR in which we highlight some of what the evidence supports, whether it is in the form of best practices or the current state of evidence for use of one particular diagnostic technique or systematic reviews and meta-analysis, or often a cost-effectiveness analysis that is the first to answer a particular question.
And we've certainly benefited from having evidence synthesis as its own section. Stella, we appreciate your joining us today.
My pleasure.